In general, the management of dystonia lies initially in a medical field. That is, because it costs you high exchequer, and very few people can afford this kind of DBS surgery. The last, apart from all this medical and surgical management, neurorehabilitation plays an important role. Hello, I'm Dr. Sanjiv C, Senior Neurologist and Movement Disorder Specialist. I've been practicing in Bangalore for last 30 years. Today I'll be talking on dystonia. What is dystonia? Dystonia is nothing but the excessive involuntary muscle contraction resulting in repetitive twisting movements of the muscles or fixed position of the muscles resulting in abnormal posture. So it could be focal dystonia, generalized dystonia, and multifocal dystonia and segmented dystonia. Coming to the focal dystonia, the best examples are writer's cramp. While writing, they develop a dystonic posture of the fingers, forearm with the pain. That's called writer's cramp or writing dystonia. And the other focal dystonias are musician dystonia, like guitar dystonia while playing guitar, while playing flute, embouchure dystonia, etc. Then regarding the focal dystonia, majority of the cases it's of idiopathic, maybe of genetic origin. Rarely secondary symptomatic causes have been described secondary to brain tumors. Any lesions, vascular malformation or lesions in the brain can cause dystonia on the opposite side. Generalized dystonia are again majority of the cases it's of idiopathic genetic origin. There are exceptions for this one. We do come across with the patients having neurodegenerative, neurometabolic disorders. Examples: Wilson's disease, copper excessive storage disorder. Then we can see in neurometabolic disorders like Niemann-Pick, Gaucher's disease, etc. Other causes of like infection, any brain infection, stroke, tumor, autoimmune encephalitis can cause dystonia, especially in younger individuals. Sometimes drug-induced, very commonly drugs used for psychiatric purposes, can have a side effects on the neurological nervous system, resulting in dystonia. Rarely toxin poisonings of neurotoxic products can cause dystonia. Then coming to the cervical dystonia, as you might have seen people with the awkward posture of the neck like this, like that. That is called torticollis or cervical dystonia. Again, here the majority are idiopathic, genetic, very rarely secondary cause symptomatic, as causes have been described. In general, the management of dystonia lies initially in a medical field. That is, you have to first of all, you have to diagnose properly. For the proper diagnosis, you need a series of battery of tests like genetic analysis, metabolic screening, then CT scan, MRI, very rarely functional disorders, and electrophysiological studies like EMG have also been applied. So the medical management contains various type of drugs like tetrabenazine, traxiphenidil, etc., followed by botulinum toxin injection to the specific group of muscles to reduce the dystonic posture of the body which are severely affected. Then comes the surgery. If the medical treatment fails, that is in the resistant cases, we opt for the surgery. Surgery, there are two kinds of surgical approach. One is called lesionectomy, that is make a small hole in the brain in the area called pallidum, globus pallidum or thalamus. This is very helpful in individuals who are of focal onset, confined to the one side of the body. So such cases, they can opt for the lesionectomy. The results are sometimes very good, and we have done a lot of cases, especially with the guitar dystonia, writer's cramp. They are all doing well. The next comes the DBS, deep brain stimulation. It's used mainly for generalized dystonia, which are again drug resistant, and those who can afford this kind of exorbitant kind of surgical management. Apart from all this medical and surgical management, neurorehabilitation plays an important role. especially the occupational therapy, physiotherapy. This has to be implemented strongly in the cases like this to overcome the deficiency of any medical or surgical management. Thank you, one and all.